Hello everyone, I am Dr. Pradeep Karan Panchadi. I am a consultant interventional pulmonologist at Place Hospital, High Tech City. So we are going to a series of videos where we are discussing about regular and normal pulmonary problems. So this time we are going to focus on one of the most important problem in India and whole world, that is tuberculosis. So in this video we'll be learning about what is tuberculosis, what causes tuberculosis, what are the signs and symptoms of tuberculosis, is tuberculosis treatable, curable, is it permanently treatable. All these questions will be answered one by one as per your understanding. Tuberculosis is an infective disease caused by bacteria. The bacteria causing tuberculosis disease is called Mycobacterium tuberculosis. So going back to history, initially in the earlier days, in our primitive days, tuberculosis was termed as the captain of white death. The reason being, the lungs of an infected patient were looked totally white on autopsy. That indicates that it is a disease where it will eat away the lungs. The lungs will be almost like a cheese. So that is the reason they call it as white death, and it's called the captain of the white death. So, and it is a communicable disease. That means a patient who is infected with a tuberculosis disease can have a high propensity to transfer the disease to others. The main way through which this disease propagates is through droplets. That is, when we speak, most of our sputum droplets will be dispersed into the air. This tuberculous bacillus or bacteria will be contained in these droplets, and whoever inhales or ingests these droplets will be prone to develop this disease. So one should remember that whoever exposed to tuberculosis may not develop the disease. In India, where tuberculosis is prevalent, there is almost a chance of 95% of whole of Indian population are infected with tuberculous bacteria. Every infected person need not develop the disease. So what happens is, disease is different from infection. So from birth itself, we will be infected with the bacillus or bacteria which are mostly in the environment, in what we air, in the air what we inhale. So they enter into our body. Who have the strong immunity, this bacteria, once it enters, the immunity of our body will contain or limit the infection, and it will be supposedly present in somewhere in the lymph nodes. So in the coming generation, as the age progresses, once the person weakens, this bacteria may be reactivated, means the bacteria may be sleeping inside the lymph node or anywhere. It may get reactivated, or some super added infection, that means another tuberculous bacteria may enter into the body, and that may cause the disease. The first sign of tuberculosis, usually it is the cough. So you should remember that the symptoms of tuberculosis are not alone and not omnistic, means they can be varied. The common symptom is cough. Other symptoms including cough will have an expectoration or sputum production. The sputum, when comes with an infection with tuberculous bacteria, is usually yellow or greenish in color. Sometimes there may be blood in the sputum. That is a serious indication. And also the other symptoms are fever, means the fever of a tuberculosis infected patient will be usually low grade, that is, it will be ranging from 100 degrees to 101 degrees, and also mostly it will be in the night times, means evening rise of temperature. Throughout the day the patient will be feeling better, but at the end of the day, as it comes to the evening, the fever starts to rise and he will feel very weak. The other constitutional symptom is loss of appetite, that is, the patient will have decreased appetite, decreased will to take food. This consequently leads to loss of weight. Loss of weight can be within 1 or 2 kgs, or it may be more, depending on the duration and chronicity of the symptoms. So coming back to fever, sometimes it is observed that tuberculosis fever might have night sweats, means temperature will be high in the evening. When it comes to the night, suddenly the fever drops with profuse sweating of the body. It is said that the bed sheet on which the patient lies down will be drenched in sweat because of a tuberculous fever. These are most common symptoms. Other symptoms depending on the disease and the severity of disease are breathlessness. When bacteria infects most of the both lungs, then the patient starts developing breathlessness. This breathlessness may be initially seen on exertion, that is while doing work, and it may progress to while patient is just sitting and he may develop severe breathlessness. It is mostly through respiratory droplets. Respiratory droplets meaning when we have saliva in our mouth, this bacteria, it will be staying in the saliva secretions. So whenever we speak, the saliva droplets will be thrown into the air. It is a common mechanism. So this bacteria which are present in these minute droplets, they will be entering into the opposite person's body when he inhales or swallows whatever respiratory droplets that will encounter into his vicinity. So once it enters into the body, this bacteria, if the person is weak, is prone to develop the disease. If his immunity is good, then most probably the infection, whatever it is caused, will be limited to a certain amount and patient may not show any symptoms. So tuberculosis is an infective disease which is caused by a bacteria. The bacteria causing tuberculosis is termed as Mycobacterium tuberculosis. This Mycobacterium tuberculosis is one of the bacteria that is causing tuberculosis, which is most commonly we encounter in our practice. There are other types of tuberculosis which are termed as atypical Mycobacterium tuberculosis. This will not respond to regular treatment. So the regular tuberculosis, again, it is divided into different types. First one is drug sensitive tuberculosis. That means this Mycobacterium tuberculosis bacteria which is infected to a person, mostly it will be sensitive to the regular treatment. Then it is called drug sensitive tuberculosis. If the bacteria, due to some sort of mutation or some other causes, if it develops resistant to the medication that we are usually giving to treat the tuberculosis, then in that case it is called drug resistant tuberculosis. Quite easy to answer, that is yes, it is communicable disease. It is so communicable that the World Health Organization and our combined with our Indian government has launched a red alert, because a single infected tuberculosis person or a single tuberculosis patient can transmit a disease to about 100 to 500 persons in a period of 1 to 2 months, or it can reach up to thousands if it doesn't get treated properly in his whole lifetime. So you can understand, if one can transmit the disease to 100, then a 10, or our India, where we are reaching a population of 2 billion population, so you can imagine the burden of the disease. Similarly, all third world countries, that is African countries and even our developing countries, Southeast Asian countries, everywhere the problem is rampant. So the major problem is that it can be transferred from one person to another person. The load of the bacteria that is required to be transmitted to one person to another person is very less. Let's say it's around 1000 bacillus per sputum sample. That means if an infected person continuously speaks for 10 minutes, he is likely to infect around 10 people. So it's mandatory for you to get checked in case of symptoms of tuberculosis, including cough, fever, loss of appetite, loss of weight, breathlessness. If any of these are there, it's better you get checked first and get treated properly. Do not hesitate to get treated to tuberculosis, otherwise you are a risk to yourself and risk to your family and a whole community. So tuberculosis diagnosis is basically two types. One is confirmatory diagnosis or microbiological diagnosis. Second is supportive and radiological diagnosis. So confirmatory diagnosis, the gold standard confirmatory diagnosis, sputum examination. So from previous days, earlier days to present day, the most commonly used test is sputum for acid fast bacillus. This is a staining method where the sputum sample of a person is stained and looked for tuberculosis bacteria. Sometimes because of low count or maybe sputum inadequacy, the sputum for AFB may be negative. Then in those cases there is a latest test that is called gene expert test. This test primarily focuses on DNA of the bacteria, tuberculosis bacteria. So doing this test, the sensitivity of diagnosing a tuberculosis patient has gone up to 80 to 90% in a sputum sample. So now the first one is sputum for AFB test should be done, and the second one is sputum for gene expert. In cases where the sputum patient is not able to bring adequate sputum, or if there is no sputum, or if sputum sample is negative for gene expert and AFB staining, still if the physician is having a high suspicion of TB in the patient, the next procedure would be bronchoscopy and collecting bronchoalveolar lavage. Bronchoalveolar lavage is nothing but will be pushing and taking water from a distant alveoli through the airways. So this sample will be again tested for TB bacilli including AFB and gene expert. The yield or the sensitivity of the ball for TB bacteria will go up to 95 to 97%. So once these are the confirmatory tests, and gene expert has also an additional advantage not only diagnosing the TB in a patient, it can also diagnose a multi-drug resistant TB. The next one is if in cases of if the sputum sample is negative or ball sample is negative, still there is a doubt, then you have to send for TB bacteria culture and sensitivity. This culture and sensitivity, depending upon the culture media, the reports may be available within 2 weeks to 8 weeks, that is half a month to 2 months. It depends on the type of culture media used for the growth. So these are all the confirmatory tests. Now coming to supportive tests. What are the supportive tests that commonly employed in diagnosing a TB patient? So the most common test is MAN2 test or tuberculin skin test. In this test, we will be injecting a small quantity of protein of the surface protein of the TB bacteria into the patient's skin. Subcutaneously it is given. The reaction depending on this test will be done and it will be read after 48 to 72 hours. The test will be given positive depending on the width of the area that is involved, means the reaction wheel, there will be swelling, the swelling will be measured, horizontal measurement will be done, and if it is greater than 10, then it can be safely understood that the person has been infected with TB bacteria, but it doesn't specify that he is having TB disease. Similar test to tuberculin skin test or MAN2 test is another one is quantiferon TB gold test. This test usually will be done by taking blood sample from the patient. The same as tuberculin skin test, this also doesn't diagnose the TB disease, but it will only tell whether the patient is infected with TB bacteria or not. Infection with TB bacteria doesn't imply that he is having TB disease. The other thing is radio diagnosis. That means in some cases, even though with sputum or bronchoalveolar lavage or MAN2, everything may be negative, but the radiological picture that includes X-ray and CT chest may strongly indicate that the patient is having a TB disease. In such cases, the clinician has every right to treat the patient as TB, naming him as clinically diagnosed TB. Yes, TB is curable, and that too if you are taking correct treatment it is curable for the lifetime. If you are not taking properly, then there is a high chance for developing drug resistant tuberculosis. So coming to the first is drug sensitive TB. The treatment for drug sensitive TB consists of 4 drugs. The drugs being isoniazid, rifampicin, ethambutol, pyrazinamide. These drugs will be given to the patient for a period of 6 months. Mind you, the treatment for TB is 6 months, drug sensitive TB. These 6 months will be divided into 2 phases. One is intensive phase, which consists of 4 drugs given in for a period of 2 months. The 4 drugs being isoniazid, rifampicin, pyrazinamide, ethambutol. The next 4 months of the 6 months regimen, it will be given. It's called continuation phase, and it consists of 3 drugs. The 3 drugs are being isoniazid, rifampicin, and ethambutol. Pyrazinamide will be omitted from the regimen after 2 months of treatment. So during the treatment, it is mandatory for the person to be checked regarding whether the patient TB is getting treated or not. So the sputum sample for TB patient after initiation of treatment is to be given after 2 months and after 6 months at the end of the treatment to check for any remaining disease. Once 6 months are completed, if a patient is symptom free and everything is normal, the treatment can be stopped and patient will be declared as TB treated. Now, in some scenarios where patient is having liver disease or kidney disease, we are forced to modify the regimen because TB drugs have effect on liver and to some extent on kidney. So in case of a liver disease, we cannot give the regular regimen that we have discussed, that is 2 + 4 6 months regimen with 4 drugs. It will be modified depending on the patient's condition. The similar modification will be done basing on the patient's kidney status also. The treatment duration in such cases may range from 6 months to 12 months. So this is regarding drug sensitive TB treatment. Coming to drug resistant TB treatment. Drug resistant TB is a very dangerous disease because the treatment of this kind of MDR TB or multiple drug resistant TB is very difficult. The bacteria may or may not respond to the treatment. This treatment, again, the duration will be ranging from 9 months to 24 months. This duration is so vast because it will be again categorized as per the patient's culture and sensitivity reports. So if patient is having everything normal and if it's properly sensitive to most of the effective available drugs for MDR TB, then the treatment will be completed within 9 months. The newer drugs, so there are many new drugs which are including bedaquiline, delaminid, protamidine. All these drugs, there are multiple regimens are coming up by the WHO and our national RNTCP program. All these will help to decrease the treatment duration. So, how to strengthen the lungs after tuberculosis infection? It's once you are treated with tuberculosis, about 40 to 50% of patients will be having some amount of scar tissue in the lung. That means there will be some remaining damage to the lungs. It's not about strengthening of the lungs. If in about 50% of the patients, there will not be a mark saying that he had previous TB infection. In those persons, he will be quite normal. There is no need for any medication. But in the rest of the 40 to 50% where TB had left some sort of mark, we call the marks as scars or fibrosis. Depending on the fibrosis, there can be bronchiectasis or total lung involvement that differs. If there is any minimal fibrosis or minimal bronchiectasis, there is no need to worry, lungs are perfectly fine. If the disease is extensive, causing extensive fibrosis as extensive damage leading to extensive bronchiectasis, then in such cases, he might be requiring long-term treatment similar to an asthma patient, where he might be required to use inhalers, chest physiotherapy, breathing exercises. Without this, there is no particular thing to say to strengthen the lungs post TB infection. There are so many genetic diseases, but tuberculosis is not one among them. Tuberculosis is pure an infectious disease which is caused by bacteria. It is not caused by any genetic abnormality. So there's a saying that prevention is better than cure. So in the similar way, TB can be prevented. So the most common way to spread a TB is from a TB infected patient. So the first thing that you should follow, once any person is diagnosed as TB, he should take treatment properly. Second one is he should maintain cough etiquette. That means he should cover his mouth while coughing by holding his hand like this or by a handkerchief. He should not sneeze or cough openly, which will cause more infection to be spread. In the similar way, once a person is infected with TB, it's advisable that after initiation of the treatment, it's advisable for a person to be isolated. Means he should be in isolation for a minimum of 2 weeks to 4 weeks until his sputum becomes negative. During this period, it doesn't necessary that the person should not be touched or anything. It's not like that. It's only if he is having symptoms, he should maintain his distance from others so that he will not spread to others. A TB patient, he can eat with others, he can sit with others, he can bath with others, he can use the same towel, nothing. Only thing is that he has to be take care that he should not cough in front of others without proper protection.